Hey y'all, I hope you're well. Welcome to another episode of Healthcare Boulevard. This is a podcast where we shine more light on healthcare, and our goal here is to provide more options to people looking to choose healthcare as a career path, regardless of their background. My name is Sena Kapomo, and I am your host and creator here. I thank you for tuning in. I appreciate your support. Remember, you can tune in on YouTube or wherever you get your podcasts. Without further ado, let's get into today's episode. Alright, welcome back again, y'all. We are on the mic today. Well, I'm on the mic, and we are going to be doing the preliminary or intro, the raw intro of pharmacy as a profession. If you haven't yet, check out my last episode, which was our first episode on pharmacy as a profession, and I had a pharmacy student on there, and we had a nice interview, getting a view of the process essentially of getting into pharmacy school, and she also gave us a forward looking of what is to come thereafter. So that was a great interview. It was a great episode, a great way to open up the page on pharmacy. And so today is just me. I don't have anybody else here with me. And I'll go into just the basics, I should say, of pharmacy as a profession for anybody interested in the profession. So, as I mentioned before, I'll do it again. I get most, if not all, of our information from the AACP. Now, while doing my research, they refer me to another website, which is pharmacyforme.org, and in that website is hosted by AACP, and AACP stands for American Association of College of Pharmacy. So they are the professional organization for the professional organization for the profession of pharmacy. But you get it's a lot of P's. So let's do this thing. So what is a pharmacy? What is a pharmacist? Pharmacists are medication experts who enhance patient care and promote wellness. They use their professional knowledge as pharmacists to prepare and dispense prescriptions, ensure medicines and doses are correct, prevent harmful interactions, and counsel patients on the safe and appropriate use of their medications. So that gives you much of what you need to know about pharmacists. So that is what they do. I will want you to remember, and I might say this multiple times, pharmacists are found in so many different settings, and nearly every setting you can any specialization you may think of for medicine, you can specialize in that for pharmacy, and we'll get into that. I'll give you some of those names later on. So that is simply what a pharmacist does. Now the next question I will answer here today is how to become a pharmacist. Now, I'm gonna start by taking this from high school. So you finish your high school, you have 2 to 4 years of pre-pharmacy study, and what that means, the reason it varies is, unlike some other professions like med school or PA, you don't need a bachelor's degree. There may be some advantage to having a bachelor's degree, and depending on what your route is, if you haven't even decided you wanted to do pharmacy school until you are already like close to finish your bachelor's degree, you may end up getting one anyway. But what it is, the point is, you don't need it. It's not required to have a bachelor's degree, as long as you have your prerequisites and you have your entrance exam. So the entrance exam is PCAT, and that stands for Pharmacy College Admissions Test. That's the entrance test that most schools require. What I found is that that's about 80% of schools require PCAT. And that leaves you only about 15% that don't require PCAT. So though that is an option to get in without PCAT, the number of schools that require is so large that it's essentially like, yeah, you need a PCAT to get into pharmacy school. Now, if you are wanting to get into pharmacy school and you are a terrible test taker, I feel for you. I really do. I am dealing with the same diagnosis in my life and that stuff. You can take your chance with applying to those 15% of schools that don't require PCAT. Of course, you're limiting yourself very greatly, so keep that in mind. Now, I will give you this resource, which is pharmacist.org, and they give you, this is a great resource for anybody deciding on which schools to apply to and what needs to be done and everything, because they have different directories for pharmacy programs, right? And so I would take a look at this if you're somebody wanting to apply to pharmacy school or strongly considering pharmacy. I would definitely look at that. This is all about the schools and picking your school, and it's a great resource for that. So that's all I'm going to say about that resource. And I remember I will post all of these links on the description of this episode for you to look at. Okay, so you got your prerequisites. You took your PCAT. You may or may not have your bachelor's degree depending on which route you're in. So you had the 2 to 4 pharmacy. Now you get into pharmacy school, right? Yay! Congratulations. That's a big step for any healthcare program. So you're in pharmacy school. That's 3 to 4 years. I was actually under the impression that it's only 4 years, but it's interesting what you find when you do your research is that much like PA school, the years can be different depending on whether it's an accelerated. So traditionally it's 4 years, but there are some programs that offer accelerated options for you to just get it done in 3 years. Keep in mind that if you're going for that means less break period. So totally keep that in mind. Okay, so pre-pharmacy school, you're going to pharmacy school, you do 3 to 4 years of pharmacy school. When you're done with schooling of pharmacy, then you need to take your license. You need to take your exam and pass your license. Pass your exam and then get your license. The name for the exam here is NAPLEX, and that stands for North American Pharmacist Licensure Exam. So NAPLEX. So you take the PCAT to get in, you take the NAPLEX to become licensed. Once you're done with your licensure, you are like a full-blown certified pharmacist. Congratulations. You done a lot of big things. You did. What you can do if you want to be adventurous in your career is you have a couple options. You can do a residency, which is essentially a continued training and specialization in certain clinical setting, in certain certain patient populations or certain disease states. So hematology pharmacist, cardiology pharmacist, neuropharmacist, psych pharmacist, OBGYN pharmacist. You get the point. So that's residency. Now you can, if you're not a big fan of the clinical setting, as a pharmacist, after being done and everything, you can do a fellowship. And the fellowship is more focused on academia, research, or industry. So now everybody wants to work with patient. So if you want to do pharmacy and you don't want to work with patient directly, that's an option for you. So besides all of that, so that's it. You're done. You can, those are your options. Again, keep in mind that those after the licensure, the residency and fellowship is not required. It's an option, much like going to specializing as an MD, or specializing as a PA, or specializing as an NP, and so forth. So the specialization is an option. But if that's something you see yourself in, it definitely is a great option for you. Okay. So what is a pharmacist? We did that. How do you get into pharmacy school? We did that. What options you have after pharmacy school? Check. The last thing I want to get into today, and because I try to make these episodes short, I know my interview episodes are long. So the last thing I want to get into today is this website. I mentioned it before, pharmacyforme.org. This is a great resource as well. I will look at this, and as Meg and a couple other folks have mentioned before when I had interviews, this is a great resource for you to get started. But try to get hands-on experience. Talk to real folks who are doing pharmacy. Maybe go to their work setting if they are allowing you to do that. But that's why I enjoy having the interviews here, so that way you can get a glimpse at real life pharmacists or real life PAs and so forth in your ears, essentially. So this what I'm trying to get out of here is this give you an idea of it gives you essentially a list of all the different settings you can work in as a pharmacist. And it's a very comprehensive list, I would say. So you can work as an ambulatory care pharmacist, a cardiology pharmacist, community pharmacist. So these are the ones that we've a lot of us have come across, right? So your provider prescribe you meds, and you gotta pick it up at the pharmacist at the pharmacy. Likely you directly talk to a pharmacist, or they were part of the dispensation of that medication for you. Depending on, now I know some places setting they will have the pharmacist talk to you if the medication has certain things that you're not supposed to do, or certain things that you have to do. So I'll give you an example of metronidazole. If you're prescribed metronidazole, likely you may have a pharmacist directly tell you. Usually this will be in the written instruction, but the pharmacist will directly tell you before you pick up that medication, oh, don't drink alcohol while you're on this medication. Or say you're given indomethacin, again it's written, it should be written anyway, that take it with food, drink a lot of water, all that good stuff. But the pharmacist might also tell you that verbally before you leave that pharmacy with your medication. So community pharmacies are the ones a lot of us have come across. Compounding pharmacists. What is that? Compounding pharmacists work in high sterile control and safe laboratory, which can be independent or inside a medical facility. Very interesting. So you can tell I didn't read all of this before this, so I want to give you an idea of this, give you a taste of this, so you can go ahead and take a look at it yourself if that's something you wanted to do. There's geriatric pharmacists, hospital pharmacists, infectious disease pharmacists, nuclear pharmacists, oncology pharmacists, pediatric pharmacists, and the list goes on. So let's end it there. Oh, the nuclear pharmacy is a cool one. So they deal with they handle radio pharmaceuticals. So that's pretty cool. But yeah, so I'm going to end it here, and I try this is gonna be a shorter one. I'll end it here. I do, if you're so kind, I will I'll present something to you that I'm thinking of doing. Let me know what you think of it. I'm aiming to create, and I already studied a quantitative thing to sort of quantify these professions, which is very hard to do, I know, and a part of me is like, I shouldn't, but I also know there are some of us who are very very quantitative versus qualitative, and that's a great way to help sort of categorize or like get more information about the profession. So I'm not sure how I will dispense that information, whether it's going to be with each or I'm going to have a whole episode of just putting. So it's still in the works, but if that's something you think that will be useful for you to essentially have a number attached to each profession, let me know in the comments. I'll appreciate it. And it will help. Like if a whole lot of people are telling me, no, don't do that, I'm dropping the pens. I'm not doing it. I'm doing this for y'all. So if y'all think it's not gonna be useful, yeah, that doesn't make sense for me to do it. So let me know what you think of that. If you're listening to this on any platform, I'll appreciate a review. Thank you. That's what I'm looking for. But other than that, you'll have a beautiful day. Adios. All right, that's all I have for you today. Thank you again for joining me. I appreciate you. Please subscribe, follow, like, comment, and share. And stay blessed. Bye.